Differentiated Service Delivery (DSD) for pre-exposure prophylaxis (PrEP) aims to demedicalize, simplify, and decentralize how people access PrEP to support increased uptake and continuation of PrEP. The DSD building blocks when, where, who, and what can be adapted for PrEP assessment, initiation, early follow-up, and continuation. If PrEP is needed for the longer term, all 4 DSD models can be adapted for PrEP. Group models managed by healthcare workers and group models managed by clients. Individual models based at facilities. Individual models not based at facilities. Let's see how DSD can support our clients who need to continue PrEP. Susan is a sex worker and tested negative for HIV at her local drop-in center. Jane, a nurse who works at the drop-in center, advised Susan to start PrEP after assessing her vulnerability to HIV acquisition. Jane offered Susan a choice of PrEP methods: oral pills, the vaginal ring, or the injectable. Susan chose the vaginal ring. Jane prescribed 6 vaginal rings and provided Susan with condoms and an HIV self-test. Susan could collect the first 3 rings from the drop-in center. After 3 months, Geeta, a peer sex worker, visited Susan in their community. Geeta helped Susan perform the HIV self-test and provided her with 3 more vaginal rings and additional condoms. 3 months later, Susan returned to the drop-in center to see Nurse Jane for a full clinical review. Without DSD, Susan would have been asked to attend the HIV clinic at the hospital in town to collect her PrEP and be tested for HIV. The opening times of that clinic are not convenient, and there's usually a long queue. Susan also does not want to be seen at the HIV clinic, as then people may presume that she is living with HIV. For Nurse Jane, without the multi-month dispensing of PrEP and the support of the peer sex worker Geeta to distribute the refills, the queues in the clinic would have been much longer, and she would have not had much time to spend with other clients starting PrEP. Doris is 10 weeks pregnant and tested negative for HIV at her first visit to the antenatal care ANC clinic. Her husband tested positive for HIV, and so midwife Elsie offered Doris PrEP. Doris was able to start her oral PrEP at the ANC clinic. After the first 3 months, she collected 3 monthly PrEP refills at the ANC clinic on the same day as her ANC appointments. Without DSD, Doris would have needed to attend the HIV clinic on another day in another part of the hospital to collect her PrEP. This would have meant extra costs for transport and asking friends to look after her other young child. For Elsie, DSD meant that she was able to coordinate Doris's care and counsel her about the importance of PrEP, including throughout her pregnancy and delivery and during breastfeeding. Togo is studying at college and tested negative for HIV when she went for an STI screening visit. Nurse Pepile assessed Togo's vulnerability to HIV acquisition and advised her to start PrEP. After the initial follow-up period, Togo was able to collect 3 monthly refills of PrEP, along with condoms and an HIV self-test at the local private pharmacy. She attended the STI clinic for a full clinical review every 6 months. Without DSD, Togo would have been asked to attend the local HIV clinic for her PrEP, and this would mean missing classes and needing extra transport money. For Pepile, having the PrEP refills available from the pharmacy means that she has more time to spend with clients who are starting PrEP or having challenges.